Hello everybody, my name is Dr. Antoine LaFleur and I'm the Associate Medical Director for the Gainesville ED, but guess what? I am taking over Brazelton today. Welcome to my house. I'm going to give you a tour. Let's go. Okay everybody, so this over here is the nurses station. Right behind this is the ED provider work area where you have our physician, our toxicologist, Dr. Kartik Shah, our advanced provider, David Wade. Over here, this is where you're gonna learn a lot of EM pearls. You're also gonna do your charting over here. And when you're not doing that, this is where a lot of juicy gossip goes down. Don't let a program tell you that there's not gossip going on. So this is one of our trauma resuscitation rooms, one of 21 rooms in our emergency department where you're gonna see the sickest of the sickest, your heart attacks, your STEMIs, your trauma alerts, strokes will come in here, your critical alerts, respiratory failure, everything goes down in here. So if you need to do a cricothyrotomy on someone, it's going down in this room here. Now, let me be honest. Even if we're not in this room, we can do whatever we want to do all over the emergency department because guess what? We are a bunch of bad ass-scared mama who we are, emergency department physicians. We will do whatever, anywhere, anytime. This is where it's going down. Although here in the Brazelton Emergency Department, we have 21 beds, the reality is that you're gonna see anywhere between 40 to 50 patients during the shift here because we will just use the hallway, we will use the waiting room, wherever we need to take care of a patient, we will. The cool thing about this residency program is that we are young, we are flexible, we are experienced, we are the smartest of the smartest, and we do some really crazy stuff here, and we're family. Over the next 3 years of your life, it is going down both here in Brazelton and in Gainesville. Let me take you to Gainesville. Okay, everybody, welcome to my main house in Gainesville, Georgia. Let me give you a tour of what we're doing here, okay? All right, this is my main trauma room here, where it's really going down. Here in this room, I'm talking about opening up a chest, doing a thoracotomy, grabbing a heart, taking that heart out, putting it back in. It is going down in this room for sure. As you can see, it's a big room, but it might get a little crowded. And so sometimes we have to direct people to where they are. So we got spots on the ceiling that says the trauma surgeon stand here, emergency provider stand there, PGY1, meaning you, is gonna stand right here and be ready to put a chest tube in on that side of the bed. And once you're done with doing that, you can even check the room, make sure everybody got cool socks. Look at that. This is one of the prerequisites for the program. You gotta have cool socks. If you don't have cool socks, do not come here. All right, so in this area here, we also have our nurses station right here. Right behind this area, we have our unit assistant area where they can call any consultants that you need. And then even behind that, we have our main ED provider work area where you have residents and students, the attendings. Now, word of wisdom here is your nurses, these are the true superstars of the department. As a PGY1 or an intern, if you don't know what to do, the best person will stand here and say, well, so Emily, what would a good ER doctor do right now? This is the superstar of the department right here. Okay, this is just another area in our emergency department called the G area, where all the rooms are connected with curtains. Now in this area, you're gonna see your bread and butter of emergency medicine. You're gonna see appendicitis, you're gonna see DKA, you're gonna see a lot of your sick pediatric patients. We have about 12 beds in this area, but we can flex to about 20. Okay, everybody, remember I told you that we're a bunch of badass, your mama, who we are, emergency department physicians? What I mean by that is that we will take care of patients everywhere in this large department. Even though we have about 84 beds, the reality is that we'll take care of over 100 patients at one time. We just left the G area. Now, in our main ER, we have A, B, C, D, E, F, G. Patients all over the place. We can take out a foreign body here, there. We can even intubate someone right in CT. If we need to do a cricothyrotomy or even put a chest tube, we will do that wherever we have to do it. This is the place you want to be. Okay, everybody, now I already told you that one prerequisite is that you gotta have really cool socks to be in this program. The other thing is that you absolutely have to like crazy. Now, crazy, what I mean is that you can't get used to the comfortable. This is one crazy department. So crazy is that we're out here in the ambulance bay. A typical day is that we may have about 7, 8 ambulances lined up, and we don't have any room in our main emergency department. Be ready to take care of patients in the ambulance while they are out here in the ambulance bay. I'm talking SVT, I'm talking acute chest pain, I'm talking STEMI. This is real life craziness where you literally will take care of patients in the ambulance bay and then go back inside.